Well, good evening. This is Dr. Bill Wyatt again with a little video here on how to make these bonded blocks. We've talked about them a lot and show them in use a lot. And a lot of people may know how to make them fine, and that's good. Just go on to the next video. But I'm going to run through the method we use, and it works. So we can put bonded blocks on one side of the posterior or two sides back here, or we can put the bone in the front part of the mouth and actually make teeth shaped into them. In some of the cases we might do that. So let me just kind of run through this as fast as we can, and so you'll see how to actually do this. This case right here, we've got a crossbite. It's coming in right here. This tooth is getting behind that, and you can't see it right here unless we put the teeth together. So we had to build up the back end back here to open it up so we could bring the tooth through the gap. And the other side had a little bit like that too. So we're going to bond blocks on the sides of both of this case, and we'll show the case how it's class 1 and all this good stuff. There's a lot of other orthodontics in the case itself, but I wanted to show you how to do these bonded blocks. And so we're going to put them on both sides, open this up, and then we can continue with the orthodontic procedure. Now I can tell you, if you're suffering from the temporomandibular joint problem, and 9/10 of these people that have pain with it, if you could advance their mandible enough to get the condyle out of the retrodiscal tissue, the pain will stop. You have to get the inflammation down on it, but it will. That's the reason for it. They may have been hit in the mouth, or have a car, somebody running to the back of you and pop your neck back here, and it jams the condyle into that retrodiscal tissue and damages it really, and it swells up and gets sore and hurts. If you just keep using it, it gets worse. So if you want to get some relief from this right quick, you can move your jaw out like this. But if you bite on these teeth in the front, the pressure that is here and on the teeth. So you got to put something between here. So if you make a little bite plate of some sort that you would bite together with, you get one of these football mouth guards, heat them up, put them in there, and see where you have to bring your jaw to get them to go. So put this little mouth guard material after it's heated in your mouth, and close it too on that spot. And you have to put some separator on the bottom because you want this thing to stay up in there and harden, and you can take it out. And now when you bite your teeth forward, you got something supporting it back here, where this goes up here rather than up on the condyles back in the back part of the mouth. I didn't really intend to stick this in here with making the bonded blocks, but you can make a bonded block and just put your mouth in a forward position and close it, and this you just closed into there each time. The load would go in the back part of from this jaw up to this bone, then it can take it. But if you bring your jaw forward and close too with your front teeth, it goes from the front teeth right here all the way to the condyle back in the back. And if you bite hard out here, it puts more pressure back here in the back, because the muscles that close the jaw are back in the area around the second and third molar back in the back. Okay, so let's kind of get on here with building the block. And if you've got a TMJ problem and you want to put some blocks, get somebody to do it, you'd have to do it yourself. Now you can do the mouth guard yourself, by yourself. You take it out and grind the bottom off level where each tooth is touching back up, so you can move your jaw around and keep the thing in place, and it'll keep it up here for you. When you put pressure, the condyle won't go down and mash the retrodiscal tissue. That's just a personal way to to relieve the pain you have, but you've got to get the inflammation down. If you were hit or hurt or mashed at, and it's all inflamed. But if it's hurting like the dickens, regardless of how it got there, you can bring it forward and it'll help. Nearly 9/10 of these TMJ cases, the pain is right where the condyle mashes the retrodiscal tissue, which is highly vascular. All right, so making these blocks could, if you had to make them yourself, you own yourself, you wouldn't work, but you could put them on somebody else, and that'll give them some temporary relief till you make a proper splint for them, and that's all the splint does is put the support down in this area right here, and we wear an upper splint normally, and you have a ramp on it where your jaw hits this ramp and brings it to this spot, so you can't go there and chew in that position anymore while you've got the splint in there at least. All right, let's go on and look here. Now we put them on both sides of the mouth, and we make these bonded blocks out of you could just use this plain old lab acrylic, but you could get this fast cure type acrylic, and you can come in and you're going to have to etch what we'll use this fast cure acrylic, and we put a little of the powder in this little glass dish over here, and we're going to take a brush and wet it with the liquid and put it in there, and we are going to etch the teeth that we're going to use we're going to put this on top of. So we're pouring this fast cure acrylic in this little rubber dish, and we'll get some in this glass dish. Now put some liquid over here in this bowl right here, and we take a small water painting brush, just a little tiny, small brush, get some liquid on it, touch it in here. But this is after you have etched the bottom teeth. Now here we take this etching material and you put a little bit of that on the cotton, and you dry the mouth out. And now we put this etching material on the occlusal surface of all the teeth you're going to bond this block to. Just put it on there for just a few minutes or a little bit, and let it etch into the grooves of the teeth. And then you're going to come back and wash that out and rinse it off and dry it out completely dry. And now you take your brush that you had your acrylic on, you dip the brush in a little bit of that liquid, it touches in the powder over here, and then you take that brush and go back to the teeth with it, and put the etching material in here and wash it and dry it. This is a dryer, and clean that out. And now we're going to take the brush with a little bit of the acrylic on it and touch it into the tooth, and put this acrylic in there with a liquid in that, so that it dissolves the acrylic and it soaks it into the crevices in the teeth. You see, there'll be little deals in the teeth coming across, and you just want to bond this right on top of the teeth. You don't need any of it on the side. It'll stay on. I've never had one of them come off, but I'll show you how to take them off now. So you put that on there. Now you go over here, you've wet this acrylic in this rubber dish, and this is beginning to cure, and you go around the edge of it, and it'll come out. You'll make a little section, space in between, and it doesn't stick to the rubber cup. So you pull that little wad of acrylic out, and then with your fingers just mold it out into whatever you think the thickness that you're going to need it. And now we're going to take that and we put some liquid on where we're going to put it on top of this fresh acrylic that we put on the teeth, and put a little more liquid there, and we press that down on the teeth, and we've taken Vaseline or some kind of lubricant and run it on the top teeth up here above, so that when you bite down on this, it won't stick to the upper teeth. And you press this down, and you go to the spot that you marked on your teeth there where you want the jaw to close, and you press that on there. Now, you can come back after you open up and you've got the indentations of the teeth, and all you need is just the material on the occlusal surface. You can take a number 12 barred Parker like that, and just reach down there and you can cut the stuff off that you don't need. You just go around and cut the excess off, and all you're going to need is just that that's right on top of the teeth there. Now we go in and cut that off and take it, just throw that away, and we'll do both sides like that. And we've got it on the molars up through the bicuspids over here, and all the weight and chewing now is going to go up and down on these blocks, you see. And so while we've got this open, we're going to straighten the cross bites that they've got in there. And if you've got a TMJ problem, if you moved your jaw out to where it's comfortable and you made these on somebody and just turn loose, the only problem is making the person chew in this position. So we put a ramp on it out here, and the front teeth out here have to slide up down on that ramp, and that keeps them in place. So you got to make you a shell to do that. But this would relieve the person if they just keep their jaw forward and close into that. That will relieve the person, but when you're asleep, you're just not going to do that. So we put a ramp on there, so when you go to close your teeth together, you've got to bring your jaw forward, and that'll keep the condyle. The condyle back here will be out in front of the eminence in here. Maybe the eminence is up here, and the condyle would normally be here, but we'll pull it forward, and that relieves, takes the pressure off of the retrodiscal tissue. And if you want to take an anti-inflammatory drug, if you've been hit in the mouth, put ice on it as quick as you can. Do the same thing with your head. Your brain swells up, it can kill you. But the retrodiscal tissue will swell, and you'll be pushing into it and constantly doing it, and it makes it hurt all over your shoulder and everywhere. Now, you can make them like this, and you have to trim those things up. And now, this is the last picture I'm going to show on this. We take this off. You can trim it up if you want to. You can trim so that the jaw can close over this, but leave the contact points where the teeth, the distance stays the same, but they can slide their teeth around sideways. And when you get ready to take this off, I don't have a picture of it, but you've got the tooth sitting in here, and this bonded block will be setting up on it like this, and you'll have the indentation in here. Take this burr, barrel kind of burr, and go through that thing and just cut a groove. And you can see through this enough to, when you see the tooth stop, of course. And now we've got this block in here with a big groove down through the middle of it, and you take a pair of pliers or something and grab on the sides and push this in, and it'll pop one side loose and loosen the other one, and you can grab this side and kind of twist it and you can pop it, and the bond is not so strong that you can't break it that way. So that's the way we take this off. Take this type of burr, cut a groove down through the middle. You'll have a big groove down in this, going all the way down. And you mash it together, and the side that comes loose, you just pick it off, and the other side you can catch hold to this upper part and twist it, and you'll just pop right off. And so that's the way you make them, and that's the way you take them off. So I just wanted to show that to you. This is the last slide I'm going to have on that, so I hope that you get to using these bonded blocks. You can do a deep bite case and never increase the vertical height of the face by putting the blocks on the back part of the mouth. If you want to increase the vertical, put the blocks in the front. And now the teeth will move together, and you'll increase the vertical height of the face. So this is some things that you can learn how to do, and this is a pretty simple way. It looks like it takes you a long time, but you get used to doing this, and you can do this just real quick. So thank you for watching, and I'm going to close out now and say good night. It's pretty late at night now anyway, and we'll stop. And I hope you'll join us and sign up with our subscribe to our deal. Thank you now. Good night.